Hello and welcome to FEMTECH Live Lounge, a monthly discussion that celebrates the intersection of technology and the AI industry. This series is presented by Virtual Patent Gateway. Kicking off the conversation today is Shawnna Hoffman, president of Guardrail Technologies, a leading tech company focused on enabling responsible technology. Previously, Shawnna served as the chief technology leader, legal strategy, and operations of Dell Technologies. And prior to Dell, she was the ServiceNow technology workflows manager and predictive AI ops federal lead and was at IBM in digital transformation and strategy in positions including co-leader of the Global Watson AI legal practice. And with that, I'll pass things over to Shawnna.
Caitlin, thank you so much. We are so excited to be here today with some of our favorite from FemTech Titans. And let me introduce real quickly Ashley Cheung. Ashley is the principal and founder of Virtual Patent Gateway, and this is her brainchild. So we're really excited to be here today. And Ashley and I are going to be co-hosting. We have with us here Katherine Rubino, who goes by Katie. Now, Katie has become just, an amazing FemTech Titan over the years. She guides her clients across a range of transaction structures, territories, product stages, and technologies. Her experience in life science companies has led to the creation of numerous successful business-driven outcomes. Her experience as a director of Caldwell, Life Science Practice Group, has allowed her to focus on representation of life sciences companies discovering and developing, protecting, and offering pharmaceutical therapeutic vaccines, digital health, medical devices, biologics, and antibody products. And with that said, Katie, thank you so much for coming and joining us today. We're so excited to hear more from you and talk, talk with the world about the things that you've been learning. You are really in the heat of some of the major advancements, especially on the intellectual property side. So thank you so much for being here, Katie.
Thank you so much for having me. I'm so excited to be here and to talk about this very exciting area of technology and just all about the advancements and where the industry is really going. I think it's women were excited about a lot of these new treatments and therapies that are coming out that are really revolutionizing healthcare and access to new diagnostics that are also very fascinating and cutting edge too.
Well, and I think before we get really started in depth in, I know we talked about maybe a disclaimer that needs to be shared. So do you want to go ahead
Yes,
and maybe share?
that's
Go
great.
ahead.
Yes, thank you for that reminder because I
Always
always get
disclaimer.
the topic and forget to say that. So, as attorneys, we do have to just mention today that everything we talk about is for educational purposes only and is not for the purpose of providing any legal advice.
Yeah. Okay.
Perfect.
Well, excellent. And I think that we've prepared quite a few questions actually, because we have questions just in general. And I love the direction you've gone in with women's, civil life sciences specifically for women. And you have solutions that you've seen in the marketplace that really are groundbreaking. Do you want to talk about that just a little bit and maybe some of the, maybe the state of like the current state in the industry, kind of where we're going, but specific to your practice area?
Sure. I'd say probably the biggest change in the femtech space over the past few years has definitely been the integration of big data into new technologies because now we have so much more information that's curated specifically about women. And this is important to highlight because before 1994, women were not required to be included in clinical trials. So
I
that
didn't
means,
know that.
yeah, which, that's not that recent, that's pretty recent, right?
Well, I was
That's
still in
within,
college. Wow.
right, all within our lifespan. And to think that we were just taking these drugs or being prescribed different treatments or diagnostics that we had no idea in the medical community how women would react, how we might metabolize things differently, especially now we know a lot more about how our hormonal symphony is much different than men. So there's a lot of drugs and treatments that have to be dosed differently or have to be administered different ways because our bodies react differently. And so a lot of that has really kind of spurred on this revolution where all of these companies are now digging into the data and coming up with some really custom treatments designed to address problems that women face, but also understanding too that it's a personal approach to women's health that might be a little bit different than the approach to how we might treat a man. For example, one of the leading cause of death in the US for women is heart disease. And we know that the way women present with heart attacks, it's not the same way a man presents. And so using data, we can leverage those differences to now figure out how do we really kind of detect heart disease earlier and intervene with treatment so that it doesn't create this huge catastrophic health problem that is running rampant right now.
Well, Ashley, I know that you and I were speaking earlier, and you had quite a few questions. Do you want to go ahead and jump in with some of those? Because I'm curious too.
Of course, I always have questions. Actually, I prep a little bit by watching some AI. I think someone that was actually from Novartis were talking about how AI was, how it's actually taking a really significant role in the healthcare industry and also life sciences. So the very first question that I wanted to kind of chat about is, what is the current state of AI in the life sciences industry?
Mm-hmm. Good question. So I think it's important to think back to that AI isn't really new. It's been around for a long time, but what we're seeing is broader applications and utilization of AI tools that have come out in specific sectors of technology. So in the life sciences industry, 5 or 10 years ago, nobody was creating what we consider today these platform technologies where we've integrated some source of AI into a platform that helps us source drugs, find drug targets, digital health applications, right? How do we create behavior modifications, collect data on users with wearable devices, connect to the Internet of Things? All of these kind of new tools and technologies are getting integrated into these life sciences company, and that's kind of creating this revolution of new products, new services, and really a whole new way of going after finding new treatments for patients. 10, 20 years ago, it might take a really long, maybe 20 years to bring a drug to market and to really have a successful outcome and to be able to find what are the lead compounds, what's the dose. Now with AI, we're able to accelerate that process so much quicker. So now we're also seeing diagnostics and drugs and all these products getting through much quicker because we have so much data that can really move things and accelerate it forward much more quickly than traditionally we've been able to.
I'm curious, like AI, I guess, it's probably not significantly new, but it's just that it's been changing. And I guess early on, it's much more in the sort of like looking at it from a analytical tools perspective versus now it's like, I wonder how does it change from in terms of being analytical tools to become much more to help with diagnostic and sort of like preventive medicines in your based on your observation.
Yeah, I'd say we saw a lot of the diagnostic tools blow up during the COVID pandemic because now all of a sudden we couldn't go to the doctor for routine testing, right? Everybody was closed. We had to all do things virtual. So what that did was really lead to a huge amount of these direct-to-consumer type diagnostic companies popping up. And some of them accelerated the way we can do lab testing at home from the comfort of our home, to also just creating digital health tools that with the use of AI, we can answer a few questions, take a survey, and we can understand and have a good idea about a potential diagnosis that might exist in a patient. So we saw a lot of companies that were using data, even just on outbreaks of COVID-19 with geofencing, to then figure out, okay, what's the probability of where the virus is going to spread, who's at risk. You could even do some simple health screenings online that said what probability you had of having COVID-19 if you had symptoms based on your geolocation. So a lot of really interesting tools that have popped up, and that before COVID, there were much tighter regulatory laws about these types of tools, that now that's also really spurred on a growth of new technological advancements, because things like telemedicine, where they used to be restricted in that doctors could only practice telemedicine in states they were licensed in, that's been loosened up. So that's also created this shift where now there's new opportunities for innovation to come in and to also help get a lot of essential health treatments to underserved communities and people who maybe don't have access to the care they need where they're located.
Wow, that's amazing. I'm learning so many new things already. Um, where do you think that this particular, like the genesis of AI, especially in relation to like women's health, where did it come from, and where do you think this is going?
Yeah, I'd say I think a lot of where this has come from is a lot of science that's come out over the past few years, really showing the unique biological differences between men and women, that has made us realize, okay, we actually have to have a different approach, because women don't just need maybe a smaller dose of a medication. They need a whole different treatment regimen. And we've seen too a lot of medications, things that maybe work well for men, those same interventions don't have the same success rate for women. So that's really driven this revolution to come up with a lot of very creative solutions that address a lot of these underlying biological differences. And I think what's most interesting too is that this, especially with big data, now we have a lot of data that is, there's a pool of data that is specific for women. And so that's kind of also helped drive outcomes, because now it's a little bit easier to test different inventions with this data, because before we didn't really know, okay, how is a female going to react versus a man? And if we're only creating a solution for women, we have no idea of really testing this well. And so AI has kind of opened up that opportunity. And I think it's also driven a lot of change of surrounding collaboration, where, 10, 20 years ago, a lot of inventions and inventive work just in science as a whole was very much siloed. But now with startups, with big pharma, the medtech revolution, we're seeing a lot more collaborative efforts, because maybe one company is really good at the AI and another company is really good at the treatments. And so how do we kind of bring those together and accelerate outcomes that much faster, and outcomes that maybe are part digital, part traditional therapeutics? And that's an interesting area too, because we're seeing a lot more of ways with digital health applications we can remotely monitor patients. Patients can, wear a smartwatch and know, is my heart rate out of rhythm? So there's a lot of really unique solutions coming into the marketplace. And I think that it's only going to continue for years to come because we have so much more information that's readily available at our fingertips right now.
Do you think that the overall infrastructure for the collaborative effort it's going to change significantly in the next, say, few years to actually augment with the AI technology?
I think so. And I think we're already seeing a lot of that happen. So I work with a lot of high growth technology companies, and a lot of them are very early on partnering with big pharma to create these solutions because big pharma, they're very hyper focused on specific areas, but there's areas they don't have R&D teams on, or maybe they know part of the puzzle, but they don't have the resources and the manpower to be able to address other parts of it. So they know, okay, if we partner up with these different startups that are hyper focused on a specific area, we can get outcomes that are even better and come through even quicker than we could do just trying it on our own here.
Changing from a finite to an infinite mindset, hey?
That's right, exactly.
Well, what are some of the hurdles and challenges you have seen in companies, like especially dealing with the change of big data and then the changing trend for companies? And what are some of the potential solutions for sort of making the life sciences and healthcare field more collaborative?
Yeah, I'd say probably a lot of challenges right now, at least. A lot of companies are having hard times with fundraising efforts. This has been kind of a constant theme since last year. And a lot of deals that maybe were supposed to close last year, they're starting to close this year. So things in the funding realm have just been a little bit slower. But I'd say I just came back from the bio conference last month in San Diego, and there's, just because funding is down, there's still a lot of deals happening. There's still a lot of innovation happening. It's just kind of forcing companies to be a little bit more creative about the ways in which they go about doing that. And that's where maybe these collaborative efforts make sense right now, because if we can't get funding from our venture partners, how can we then maybe go create some kind of agreement with big pharma, get some cash to go, solve some problem and then move things forward? And also, I think the other solution for the funding issue too is a lot of these platform companies. What's very creative there is that they can use their platform technology to also partner with other companies, because maybe part of the platform, a specific solution on the platform, another company could use and pay them money for. So it's all about kind of rethinking where we're getting our money from, and how can we kind of get to revenue more quickly to start building up the business through different streams of revenue sources.
I love how this conversation go from women health, VC capital, fundraising, and then so the next questions I have then is, what are some of the best practices that you have seen in this area?
Yeah, best practices, as an attorney, obviously, I'd say it, number one is really thinking early about your intellectual property. Where I've seen a lot of companies go wrong is they talk about their IP too early, or they publish on it. And in the US, if you do that and you don't file a patent within 1 year from your first public disclosure, you can block yourself later on from being able to obtain patents on that innovation. So a lot of times as scientists, we might be very excited about a particular invention or a new discovery. And part of our culture is we want to go publish and tell others, because again, that's just driving the collaboration forward. But before doing that, a lot of companies need to really think, okay, is this idea locked down with IP? So that we know before we go start telling everybody about it, we're protected, and that we're not kind of having to reverse that issue later on down the road when it's too late. And then also kind of just thinking about the future goals and growth of the company. Where are we at right now today? What's kind of our goals for the next 12 months, but also long term? What do we want to do and achieve as a company? If we want to go have an exit to another company, that's going to be kind of one business and IP strategy. If our goal is to go public someday, that's going to be another. But really kind of putting the seeds in place early on, because the earlier you can start getting different parts of your business lined up for your goals and objectives, the easier it's going to help you achieve that. And it's going to take a lot of the pressure off at the end if you're very strategic and intentional about it from the start.
Wow. Almost last question.
Okay.
Because I could sit here all day, in your practice, anything that is actually, that you can actually disclose, we have the disclaimer already, something that is already public. I wonder if there's any one of particular invention or some kind of a unique innovation technology that you particularly really think very highly of, and that you've seen that solve problems, especially in the women health space.
Sure. I could probably also sit here all day and list out.
I'll just go to Boston and have cappuccino with you, and we could continue that conversation.
That's right. We need to get a date on the books for that.
Yes, we will.
But I'd say, one company that's very interested, and their office is located literally right next door to mine out the window. I could throw a stone at them, is a company called Bloomer Tech. They are a company that was founded several years ago at MIT. And what they've done is they're creating a bra that you can wear that can monitor women's heart health. And so they're kind of creating a lot of very creative solutions to address health disparities women face, in particular for cardiovascular disease. And I think this is important to highlight because this is an area where there isn't really any different treatment options for men or women, but women usually do a lot worse mortality-wise when presenting with heart attacks, because the symptoms are not the traditional symptoms of chest pain, shortness of breath. A lot of times it's misdiagnosed for other conditions like anxiety or depression. And so the woman goes to the hospital, is having a heart attack, it doesn't get diagnosed, they get sent home, and they either have to go back to the hospital, or even worse, they pass away because the condition is just not recognized in them. And so a solution like this, I think, will really be very revolutionary, especially because heart disease is the number one killer of women. And so to be able to identify when these conditions are happening and to intervene with treatments sooner, that's going to really help address a lot of these issues that females face. And I think what's interesting too is there's so many other really interesting inventions centered around conditions that are specific to women. So I'm a mentor at the Nucleate. It's kind of a biotech innovator. And one company there that I was speaking to, it's very interesting because women have, if you're diagnosed as a woman with ovarian cancer, there's really no way to detect it early. So it's usually caught when it's very aggressive, stage 3 or 4. And so this one company I was speaking to, they've created new ways to detect it with a simple blood test. And this is very fascinating too, because a lot of times there's a lot of new work coming out showing ovarian cancer begins in the fallopian tubes and then it spreads to the ovaries. So if we could find ways to detect when it's very early on in the fallopian tubes, we can intervene earlier and catch things earlier before it's become stage 3 or 4. And, then there's just not a lot of good treatment options available. And so I think that's just also a really awesome company that's finding these kind of non-invasive ways to monitor women's health conditions so that we can really detect things early on before it is too late and be able to get appropriate medical care where needed. So it's just really incredible. I feel very fortunate to be located in Boston, where there's so much unique, innovative activity happening that's really creating so many amazing medical treatments that are coming to market here.
Wow. Well, this is like such an amazing treat, and I really want to thank you for accepting our invitation to be a guest. And of course, I always am grateful to Shawnna Hoffman. And the last, well, I told you that wasn't going to be a last question. We have a few minutes left. Caitlin, do we have any Q&A? I mean, any questions from the audience? If not, I will continue asking. We got 4 minutes. Okay, nope. So, you talk a little bit about the mentoring aspect, and I really want to like sort of highlight the importance of women hyping each other. And I wonder, it was not my term. I don't remember who it is, but I did talk to one of the author, Lisa Sun, and she wrote a book called Gravitas, and that talks about like confidence. Women, especially in the IP field, we are very underrepresented. And I wonder if you have any sort of guidance for the next gen of women who wants to enter in this particular field of life sciences.
Yes, that's a great question. So I think it's something like 12 or 16% of all IP attorneys are female. So we are kind of, there's not a lot of women IP attorneys, right? And I'd say if you are someone who's interested in this field, simply write somebody who already is practicing a message, and I'm sure they would answer and be happy to meet in person or have a virtual coffee and talk about the career, what it's like, and opportunities in the profession. I probably get, 5 cold calls a month from different other, women in the profession or just law students. And I'm always happy to have a chat and explain things, because a lot of times what's unique too about the IP field is most of us had a career number one as either a scientist or an engineer. And then we kind of fall into IP by a series of random acts. And so, it's always helpful if you're thinking about a career in IP to talk to other people, kind of seek out those mentors who can really give you some pointed advice and guidance. And also think about different groups that are focused on women in IP. So one group that's actually, we're doing a big relaunch later this month on July 23rd, if anybody is in the Boston area. It's a group called WIN, Women in Intellectual Property Network. And so we're actually at our office here hosting a kickoff event to relaunch the Boston chapter. And it's basically a network of just women in IP. You could be anybody in IP. You don't have to work in IP. You could just have an interest in it. But it's a great way to kind of connect with other leaders in the field and seek out those mentorships. and opportunities to network and grow your network and meet other people in the industry here.
It's just like real estate is location, location, location. And to get like to where we want it to be, I think a lot of time we need to like keep networking. And well, we are at time. So Katie, thank you so much. And I will be sure to send you an email or let you know when I'm in Boston, and we'll go grab that cappuccino.
Yes, thank you so much for having me.
Thank
And
you so
I can't wait
much.
for that cappuccino, and we'll stay in touch here.
Well, we are already on the same network now.
Yeah.
Well, thank you so much.
Thank you. Have a great day.